Gospel AM 1490 WMBM presents your informational spotlight. The WMBM Business Spotlight is designed to introduce you to the best services, products, and an array of health, fitness, business, and entertainment information. Lights, cameras, and action. Here's today.
1490 WMBM, where ministry blesses so many. In our studio as a Business Spotlight today, we have Tiffany Wheeler from Care Resource, and she has a master's in behavioral health. Good afternoon, Tiffany.
Good afternoon. How are you?
I'm doing well. How are you?
I'm wonderful. Thanks for having me.
Thank you for being in our studio today, educating our community on behavioral health. So go ahead and speak your knowledge.
Okay, so I just wanted to give kind of an overview of what behavioral health was and what we do at Care Resource. So behavioral health and mental health, the terms are often used interchangeably. You know, in counseling, we work with both thoughts and behaviors. You know, our thoughts kind of dictate our actions, and our actions have an effect on our thoughts. So when it comes to behavioral health, we aim to promote well-being in the mind, and the body, and the soul by preventing or intervening in mental illness and addiction. So mental illness can be anything. It can be anything from depression or, post-traumatic stress disorder, anxiety, bipolar, schizophrenia. And we understand that there's a stigma surrounding mental health and receiving mental health services, especially in communities with people of color. And the statistics are this, 1 in 4 people, they're affected by mental health problems. So it's not rare, it's not uncommon, but still there are stigmas associated with it. You hear things such as, only crazy people will go see a therapist. Or, I'm not sure if you've heard this, but in our, Black community, we'll hear things such as, all you need to do is pray about it, girl, and take it to Jesus, and, that's all you need. And, we understand that faith and spirituality is a huge contributing factor to overall wellness. And in therapy, we actually use that as a tool to help individuals get better. But I believe God places educated, trained, skilled clinicians in our lives to assist us in handling difficult situations. Just like if your car was broken or, you were having physiological problems, you would go to the doctor, you would go to a mechanic to go ahead and address these issues. So with our mental health, we need to take the same type of maintenance and self-care with our minds, considering how our minds can affect other parts of our bodies. Anger weakens the liver. Grief weakens the lungs. Worry, it weakens the stomach. Stress weakens the heart and the brain. And fear, it weakens the kidneys. So think about what happens to our body over time with prolonged exposure to these negative emotions. So my question is, why aren't we treating ourselves? Why aren't we taking preventative measures to ensure that our behavioral health is sound and pretty much running in tip-top shape? Is it our culture? Is it the stigmas? What is it? You'd never say to a cancer patient, it's cancer, just get over it. So why are we doing that with anxiety and depression or years of trauma and abuse? These are all life-altering things that affect the way we think about ourselves, the way we think about each other. It affects our self-esteem. It affects our relationships, our families. So we need to start addressing the issues instead of just sweeping them under the rug and pretending that these things don't exist or that it doesn't affect us as much as it does. At Care Resource, our goal is to have a strong mind with a strong body. We're trying to connect people not only with themselves but with their family and the communities, and we do it all through behavioral health services.
Okay, that's interesting. So how long you been in the field?
I graduated school in 2011, so I've been working in the field since 2010. I've been working at Care Resource for approximately 3 years, and I absolutely love working at Care Resource. I love what I do there. I love what we stand for. Our motto at work is we put the care in Care Resource, and I truly believe that as an agency, we diligently work to make sure that everyone who walks through our doors is cared for appropriately. So
Most people would think that Care Resource was dealing mostly with HIV/AIDS, but the component, what your expertise is in behavioral health.
Yes. So historically, yes, we did predominantly deal with patients who were HIV positive or have AIDS. That's what we did in the past. However, now we are a FQHC, which is a federally qualified healthcare center, and now we do it all. So we have case management services, we have behavioral health, of course, we have pediatrics, we have medical service, we have dental, we have linkage, we have testing and evaluation. So psychiatry. We're kind of a one-stop shop, and we can see everyone, whether they have insurance or whether they don't. If they're self-pay, nobody gets turned away. We diligently work with everyone to make sure that they can adequately receive services at our agency.
And the address is?
We have 4 different locations, 3 in Miami and 1 in Broward. The one in Miami, our main location for behavioral health services is 3801 Biscayne Boulevard, and for the actual agency is 3510 Biscayne Boulevard. We also have a location in Miami Beach, we have a location in Little Havana, and 1 in Fort Lauderdale. So if you want the actual addresses and locations, you can go to our website, careresource.org, and all of our information about the agency is right there on the website.
Thank you, Tiffany, for coming and stopping by AM 1490 WMBM.
Thank you.
You was very, you gave a lot of good information, and I trust our community would take heed to it. Thank you very much for coming.
Thank you.
Thank you so much for tuning in to the WMBM Business Spotlight. Be sure to tune in again as we spotlight another great business. That's the WMBM Business Spotlight on the station that puts Jesus Christ first, AM 1490 WMBM.